Richmond is one of the healthiest places to live in the UK, with life expectancy considerably outstripping other areas. An ageing population, however, comes with its own challenges, as Sue Saville has been finding out. She's been to visit NHS Richmond Clinical Commissioning Group to see how it's working with partners and clinicians to redesign patient pathways and reduce waiting times.
What's a CCG?
Heart thing.
Oh, that's the ECG.
Oh, is it? I don't know then.
Still struggling.
Sorry, I haven't a clue.
So what are CCGs? Well, the initials stand for Clinical Commissioning Groups, which evolved from the old PCTs or Primary Care Trusts. CCGs are the cornerstone of the new health system. In the relatively affluent London borough of Richmond upon Thames, the evident lack of understanding about clinical commissioning groups concerns the leadership team, who want patients and other stakeholders to understand how caregiving is changing for the better. The chair of Richmond CCG explains that commissioning means purchasing services for the patients.
We're looking at the quality of the different services available, working out what's needed for the area, and we make sure that the services are organised, structured in the right way to deliver the right benefits for those patients.
As Richmond CCG has a high proportion of older residents, there are particular challenges here in delivering integrated health and social care.
Antoine Minassian is over 90, but he and his wife Sheila live independently at home, with help on hand from the new system of health and social care teams working together.
Do you feel more secure that way?
Yes.
Equipment, including a handrail, was installed after a home assessment. The couple are on the community ward, an innovative project to look after older people in their own homes.
No pain?
No.
That's lovely and clear.
If they did fall, it'd be hospital admission, which is quite costly these days. And also their lifestyle would probably change after a fall because they're quite elderly.
The exercise programme given to Sheila and Antoine helps them maintain balance, again reducing falls.
I do this exercise, which is very good for the torso.
Having the resources of a multidisciplinary team is something this couple say they're deeply grateful for.
The point that we have got somebody to talk to in case of need gives us a lot of confidence, really, which really improves the quality of life.
It's been wonderful, really. They're all such lovely girls that come and see us.
This leafy area has many advantages, but no acute hospital in the borough. Preventing hospital admissions is very much part of the new CCG's strategy. Richmond has successfully piloted the new Any Qualified Provider scheme, whereby money is spent on therapies like physiotherapy and osteopathy to treat back and neck problems so that patients are less likely to need hospital admission.
There's been lots of stories about, we're going to bust the budgets, it's going to go over, but if you do take it into context and you can show a reduction in secondary care referrals against what's happening in the community, then budgets should come in line.
And we've seen a reduction in referrals going into orthopaedics and rheumatology because more patients are being treated in primary care in the community.
Dr Catherine Millington-Sanders is a GP member of Richmond CCG governing body, along with a range of clinical and non-clinical members.
I think that the future looks really exciting. And I think from talking with patients and carers, we now have a real understanding of what they want. And so actually if we're able to develop care, so well coordinated, easy access in the right place at the right time, delivered by people that know about them, is really what they want.
Sheila and Antoine know that if they need planned or emergency care, rehabilitation or mental health services, or one day an end-of-life care plan, then all those services can be provided for them here in their own community.